I am Martin Gordon. I've had a long career, first in banking, and I have a complete second career working with China in the field of HIV/AIDS. I've had a lot of knowledge of China over many years because it was very much part of our family background. My grandfather came out to China before the First War and worked for some years in the Dongbei in northeast China, and so we always had a very Chinese atmosphere at home. I always tried, whatever I was doing elsewhere, to maintain the links on the Chinese side, so that when China started to open up, it became possible for me to participate in it. In January 1985, I did my first visit to Beijing at the invitation of the Bank of China. I went very frequently into China, and so I sort of drunk in a great deal of knowledge about China. Barry was my partner and my very good friend from 1970 onwards, and we lived in London and New York. Then very unfortunately he got diagnosed with HIV, and in 1996 I lost him. His death was obviously a very, very difficult thing for me to handle. Barry had said to me, "Martin, you must do something for charity." And I said that I would be interested in doing something between China and the United Kingdom on AIDS care, AIDS prevention, and so on. And with the introductions that I had, I called at the Chinese Academy of Preventive Medicine, where the president received me, the Vice Minister of Health received me, and they all seemed to be rather pleased to see me. The Chinese were terrified of HIV, as a lot of other people were, and didn't have a very good idea of how to handle it. And it was one thing in Beijing, but it's quite something else in the great mass of this big country. When we had that first seminar in May of 1997, people came from different provinces of China, and over the following years we brought groups of doctors and nurses, always nurses with doctors, to China to do workshops on AIDS prevention and care in numerous provinces of China. We also invited the Chinese to come to London to study at our hospitals. Way back in the year 2000, I created an annual Barry and Martin's Prize for excellence in AIDS treatment and care and education. These prize givings were extremely popular, and also we always gave the prizes where the prizes were earned. So we went to some very remote parts of China to give our prizes. It was very much reported in the local newspapers. It created centers of excellence, and the people that got our prizes over the years remained sort of very much connected with us, and 2 of them were made national model workers. When Barry was ill, it was the nurses who had the more day-to-day contact in reaching out to sick people. The nurses have a very important role to play. We've given a lot of prizes to nurses, and we've had a lot of nurses over here studying, and nursing in China has made terrific strides. Chinese people became very sophisticated very quickly on these subjects, and within early years we had a lot to teach them, but by the middle years and late years, the Chinese understood HIV very well. Many doctors have come over and done training in America and England and around the world, and we learn a lot from our Chinese medical friends. On matters of discrimination and prejudice, we were always a little bit ahead. All the top doctors knew that gay people existed, but had no access to them. And we certainly helped them to understand that sort of thing very well from the earliest years. The gay communities, on the whole, their way of going about things, their way of reaching out, going in the parks, talking to people and that sort of thing, has been very impressive. For example, the Beijing Yuan Hospital. We started with them something called the Quiet Garden in 2007. This has been somewhere where gay people can come and discuss their problems. And huge outreach around Beijing has been created through the Quiet Garden. In Xinjiang, we're supporting a needle exchange center. We gave some prizes to some of the HIV positive drug addict people, so that give the impression that these drug addicts were not sort of bad people. We visited very sick people in hospitals, very sick children. We were always holding them to our arms, and the physical contact made all the difference. You should always build bridges with every country. And the Chinese, with their culture and their traditions and their hard work and their intelligence, it's a joy to establish relations with these people. We have sown seeds which in China have grown to very big trees. We have helped people to avoid discrimination. I couldn't have conceived at the beginning that I could have achieved anything remotely like what we have. I think it's wonderful that we have this cooperation.